Well, welcome back to the Ricky Matthews Show. It's the second half of the show on Wednesday, so it's Singing River Health Talk today. And I'm going to be joined by two guests today about a really special ribbon cutting that's taking place today. In fact, it's at 10 o'clock this morning at Singing River Gulfport over on Community Road, right outside the ER entrance. But it's an innovative new approach. They're going to be implementing a Narcan vending machine and in partnership with numerous organizations. But to talk a little bit more about it is Heather Porter, who has been on the show. In fact, she was on the show recently. She's a hospital administrator at Singing River Gulfport. And Jan Dawson with the Mississippi Public Health Institute. She's a director of substance use education. So anyway, good to see both of you, and I hope y'all are doing well. Heather, how you been?
I've been good. I didn't know I'd be back so soon, but I'm excited to be here and share a little bit more.
Yeah, it's good to see you too. And Jan, I was telling you during the break, you haven't been on before. We're going to circle back with you and talk more about what you're all about. So Heather was on recently, and we got to hear her whole story. But why don't you tell folks just a little bit about who you are and what you do before we get into the big announcement that's taking place today?
So I'm the substance use director here at the Mississippi Public Health Institute in Madison, and we work with multiple state agencies and partners across the state to reduce overdose deaths, but also to provide education, prevention, and control. We work with several state agencies, including the Department of Health and the Department of Mental Health. And our goal is to engage communities, to work alongside of them to provide resources that they need to reduce overdoses within their communities. And that's how we ended up working with Heather, is through some mutual partnerships that we have. And we are working along the coastal area to develop a public health and safety team, which brings public health alongside of public safety. And through some of our partners that we have, the vending machine idea happened in Jackson back in August, and now we are doing the same thing on the coast, and we are really excited about this project.
Yeah, so Jan, before we get into some specifics with Heather here in just a second, I've had a series of conversations from the Attorney General to a wide range of elected officials to you name it. We've talked about it, this need to continue to focus on how dangerous some substances are these days and the role that Narcan can play actually in saving lives. And for a period of time, I saw some pushback on Narcan, but what I've noticed more recently is people becoming much more aware of that it's a life-saving tool. And sometimes people get an overdose that they don't expect to get it. And unfortunately, people die because they don't have access to it. We're having conversations now about this, that before there would have been pushback. There's been a change in the mindset, hasn't there?
There absolutely has been, and we continue to try to change that mindset. We haven't won the battle, but we do know that we reduced the number of overdose deaths in our state last year by about 200, which is significant, through the use of Narcan. Naloxone. So the generic version, the scientific name for Narcan is Naloxone. There are several companies now that produce a substance such as that. We are particularly partnering right now for this project with Patagus Pharmaceuticals, and they're actually donating the product for the machine. So we are really excited about that. That partnership has been really important to us, but also Narcan, the brand name Narcan too, has been very supportive of us over time. And we have several different ways that people can access Naloxone. If you don't have access to the vending machine, there are several other avenues, and all you have to do is give us a call at 601-398-4406, and we will connect you, put it in the mail to you, tell you another place locally you can pick it up. We just want to make sure that everybody in Mississippi who needs to have it in their car, in their purse, which is everyone in Mississippi, has access to this product.
Well, that's great to hear. You know, again, coming back to this sort of attitude shift that's occurring, what you're hoping, Heather, as a leader at Singing River Health System, is to bring awareness to the need to have this shift in attitude, and to ultimately improve health outcomes. And the vending machines, I've never heard of such a thing. But what got you guys involved in this? And you've got even more partners than Jan involved in this. Tell us a little bit about that.
So, last month we talked a good bit about our medical detox programs, right? So that's something that we've done in Harrison County community for 5 years that we've been here, and we were providing that service in Jackson County prior to the purchase of this property. So that's always been something that we're close to because of that particular service that we provide. But we have the 3 ERs, right? And every day on average, we see 2 overdoses come into one of those 3 ERs. So in my mind, it's very simple. There's this nasal spray that if you have access to it and you're experiencing an opioid overdose, which includes, that could be your street drugs, yes, but that also could be OxyContin. That could be hydrocodone. That could be any of the opioid medications that you can get with a prescription. The only way to save your life is this nasal spray. And so why not have it? In my mind, it's synonymous with learning CPR. So you
Let's see. She'll be back. We had a little technical issue, but Jan, why don't you finish your thought?
So naloxone is the life-saving device that she is talking about. If naloxone is administered, it does not have any effect on anybody if they don't need it. It is specifically designed to knock the opioids off of the mu receptor of the brain. It usually does not have any kind of side effects, but if you do need it in an event that you are overdosing, it is immediate. It is a change. The person will wake up immediately. The issue that we're having right now across the state is that the fact that we have so many drugs on the street that have fentanyl in those drugs. And sometimes even, the innocence of a middle school kid that says, hey, try this gummy, or you take this pill, it'll make you feel better, can be laced with that deadly fentanyl. And it doesn't take but a few grains of fentanyl to create an overdose. So we're also working across the state with all kinds of different agencies. We were excited when we found this partnership with Singing River, but we also work with law enforcement agents to make sure that they have it on their person or in their car at all times. So we provide training for them. We also work with schools. We can come into the school district and survey your students about the kinds of risky behaviors that they have and provide free curriculum that's paid for by the state too, to educate our students on the dangers of opioids or any other drugs or just risky decisions. So we want to be able to come in alongside of your community and provide the resources necessary to continue to reduce overdoses. And naloxone is one of those great tools.
Yeah. Jan, one of the things that was interesting, I'm a former paramedic. I went to University of Alabama paramedic school and was in pre-med, and ultimately, changed my major and went into business, and the rest is history. But I remember well, as a paramedic, a nitroglycerin tablet and giving it to someone just underneath their tongue and how quickly it acted and so on. And when that was called for, it was masterful to make Narcan a nasal spray because it makes administering it so easy.
It does, and anybody can do it. But it is just basically a nasal cannula. You put it up the nostril. You don't prime it or anything. You just let it spray. Now, you do need to make sure that the person has a pulse because of obviously the blood has to be running through the body in order for the naloxone to be absorbed through the nasal passage, but it is almost immediate. It's an immediate effect.
Yeah. Heather, we've got you back. Jan did a masterful job of finishing your sentence. And And so that worked out really well. We had a little technical issue, but we did not miss a lick.
Awesome.
Hey, real quick, Heather, you can kind of squeeze this in before we go to the other side. But who are the partners involved in this?
So, of course, the Mississippi Public Health Institute, and then we have Fund Recovery and the Reach Impact Institute. So, both of those are regional nonprofits who their mission is to get this in front of communities that need it based on data. They've started in Memphis and had good results in Memphis and other locations. So this is just the next step in that battle.
Yeah, that's really good stuff. We're talking about literally a Narcan vending machine. Look, Narcan is called different drugs by different manufacturers, but at the end of the day, it comes back to the same goal, and that is a nasal spray that has very little side effects. So if you're not having an opioid overdose, you're not going to really see anything as a result of doing the nasal spray. But if you're having an opioid overdose, it gets to the receptors in the brain and has almost an immediate impact and can wake someone up. We'll continue talking about this innovative new vending machine at Singing River Gulfport when we come back on the other side. We'll see you after this. Welcome back to the Ricky Matthews Show from the Citizens Bank Studio. We're visiting today with Heather Porter from Singing River Gulfport. She's a hospital administrator there. And Jan Dawson from the Mississippi Public Health Institute. She's the director of substance. Is it substance use education or abuse education?
Substance use. So that's part, we talked earlier a little bit about stigma around naloxone. So there was obviously some stigma around the word abuse over time, because we realize now that substance use is also related to mental health disorders, and it is a physical health issue. So we have changed that word from substance abuse to substance use as part of reducing that stigma.
Yeah. Hey, so Jan, you heard Heather just a few minutes ago talk about at their 3 emergency rooms for Singing River Health System on any given day, on average, 2 people will come to their emergency rooms with an overdose scenario. And what's just terrible, and I keep coming back to the point that you made. It could be a child, it could be a college student, it could be just someone taking a medication for someone that they have no idea where it came from. And someone's saying take it for whatever reason they're telling them to take it. And suddenly they're in an immediate overdose scenario, and too many of them die. It's just, I bet it's someone in your position to know that there is something that can be done. This is one of the reasons why some sororities, some fraternities, colleges, high schools, there's a wide range of organizations now thinking through the use of at least having available Narcan, because this is something you can do that can literally save someone's lives. And if you don't have it available to you, in many cases, you're not going to have time to get to by the time somebody finds them, it may be too late to get them to an emergency room. You know this for a fact, and I'm sure that drives you, doesn't it?
Oh, absolutely. And we have worked through several different grant organizations. We are a nonprofit in Madison, Mississippi, and all of our money is grant-written money. So we have written grants with the federal government through the SAMHSA. We've written grants through RCOR, which is a affiliate of the Bureau of Justice Administration. We work with the Department of Health. We work with the Department of Mental Health. So basically what I'm telling you is we work through every entity that we have the ability to work through to provide naloxone for individuals in the state of Mississippi. As I said before, we've worked with law enforcement to try to train as many people as possible and provide them not only with the dose that they need when they're trained, but also to provide them with replacement doses when they use it, and we encourage them to use it. We are providing naloxone to schools. We're doing training with school administrators. We have a training next week. We also work with courtrooms. We have emergency boxes that we hang on the wall in schools and in courtrooms, where all you have to do is open the door, the alarm goes off, somebody knows to call 911, and you have naloxone immediately, because it happens everywhere. So our goal is to continue to put these boxes and put the naloxone in the hands of everybody in the state. But we particularly want these boxes in places where there are large groups of people. And when we started working with Heather with the vending machine, we knew that it would be easy for people to drive up, literally put very bare information, just zip code, into that machine and be able to get that in an emergency situation, or just people that are still maybe a little embarrassed to ask for it or go into the pharmacy and purchase it. We just want that to be available to everyone, anywhere that they think they might need. Whether you think you do or not, you know somebody that's at risk. And it's always
listen, I wouldn't wait for there to be an emergency. I'd go get it now, especially if you know someone's at risk. So there's a ribbon cutting this morning at 10 a.m. at Singing River Gulfport, just outside the ER. And the vending machine, Heather, just the basics on the vending machine real quick before we get done.
So it looks like a Coke machine, except for it has medicine in it, for, naloxone. Of course, it's got instructions written on the side. It's a 3-step process. I'm not sure if you'll be able to see it, but this is the Narcan. It just looks like it's just a nasal spray. Again, zip code, 2 doses pop out for you. It's right outside of our ER. You don't even have to walk into the waiting room. Felt like even having to walk into the waiting room sometimes can be embarrassing. So wanted to just pull up, get your doses, have them in your possession to use if needed.
If you look at year to date, just in Harrison County, in the 1 minute we have left, 406 suspected overdoses, 5 deaths. 189 had a Narcan derivative administered. You think about that for a minute. My goodness. That shows you that something big time is happening to save lives. It's a shame we have to do this, that there are drugs out there that can kill people. But given that there are, it would be a shame if we didn't have Narcan widely available for people. And I'm thrilled that Singing River Health System is stepping up to the plate. Hey, we're out of time for today, but Heather, it's been a pleasure to spend some time with you again. And Janet, it was great to meet you as well. I look forward to having you on a future show.
Thanks so much.
Thanks so much for having us.
You bet. This has been Heather Porter from Singing River Gulfport and Jan Dawson from the Mississippi Public Health Institute. Really important stuff. Listen, have a great day, and we will see you tomorrow.